Plantar fasciitis, heel pain and foot pain can be debilitating and a major cause of dysfunction in someone's life. And chiropractic care has some conservative treatment protocols for this. The primary problem that we find is that the heel bone moves out of place, either with frank trauma or gradual repetitive things. And the heel bone moving out of place can stretch the plantar fascia, causing it to inflame. Also, various structures in the arch of the foot and the ball of the foot will be adversely affected. The ankle itself can actually come out from underneath the lower leg, causing quite a bit of problems with normal walking patterns and weight bearing. And the heel bone has connected to it structures like the tendon to the big toe, and sometimes the big toe pain will be the prominent feature of heel bone displacement, and arch and lower leg pain, where the big toe muscle actually starts. So we have in chiropractic care a number of safe, gentle, manipulative, and adjusting procedures that can be extremely helpful and relieve these problems for people. You feel that right there?
On the outside?
Yeah.
Uh-huh.
Okay. Heel bone displacement. And this is how we do a simple adjustment of the heel bone or calcaneus to put it back underneath the talus and restore normal function of the foot and the plantar fascia. It's really gentle. Sometimes patients don't even know I'm doing anything. They'll just feel the clicking or the clunking of the piece here, and they tell me they don't think I'm doing anything, but then slowly, do you see how that's getting less tender right there?
Yeah, it is less tender, and also I felt the change, like immediately.
Now, this is an injury, and it requires management. It's just, this doesn't hold for most people because these displacement patterns, i.e. subluxation patterns, have been in place for a while. So it takes a while to get the ligaments to retrain to actually hold your heel bone back in place. We also need proper footwear, sometimes orthotic supporting structures to help the foot maintain its normal architecture. But this is from an architectural point of view, a building code violation. And so this is how we restore the normal architecture of the foot, is with this little device. And alright, so here we have a displacement pattern of the heel bone. It's really tender in through here. It's tender on the bottom. Anytime the heel bone moves out of place, the plantar fascia is going to be irritated and inflamed. If it's sufficient enough, the displacement is sufficient enough, there will be inflammation called plantar fasciitis. Also, the big toe tendons can be entrapped. The little toe tendons can be entrapped in this scenario, so you can have pain on the outside of the foot, on the inside of the foot, in the arch, the big toe. Of course, the whole plantar fascia can be affected. This can also cause frank heel pain, this problem. So I'm doing a series of gentle adjustments here to bring the heel bone back underneath the ankle bone. I can also do with a similar protocol, bring the ankle bone back underneath the lower leg and restore the normal architectural features that keep this a functioning, pain-free structure. So, there we go. Any pain, tenderness right there?
No.
Okay, so we've relieved that.